Greeting from ECS Heart. I'm Dr. Nooshin Bazargani. I'm cardiologist in Dubai. I also lead the Cardiovascular Disease Prevention Group of Emirates Cardiac Society. Today I would like to talk to you about heart disease in women, because we think this branch of cardiology needs more attention because not enough has been done for the battle against the heart disease against women. As we all know, the most effective way to reduce heart disease anywhere is to try to find and recognize people who are at high risk of getting heart disease and coronary artery disease. Therefore, for women like men, there are certain criteria, there are certain known risk factors that we should look for, and we should aim at treatment and controlling these risk factors. We have the traditional risk factors for women to get coronary artery disease or heart disease, and those are if the woman has hypertension, if the woman has diabetes, is the woman have hyperlipidemia or hypercholesterolemia, inactivity, and unhealthy food diet also play major role in the development of heart disease in women as well as in men. Not to mention the most important one, which is the tobacco use. Tobacco use in any form of tobacco, whether it is cigarette, if it is water pipe, if it is midwah, whatever kind of tobacco use can lead to cardiovascular disease in all population and in women as well. But recently, we have actually recognized the novel risk factors for cardiovascular disease in women. So this is where I want to talk to you, where I want you to hear me, that if you have a problem like rheumatoid arthritis, SLE, or we call it connective tissue disease, please be aware that having these problems puts you in risk of developing cardiovascular disease. So what you have to do is simply ask your primary physician to take care of you and do the proper investigation. You yourself be in charge of your healthy heart. By what? By controlling your blood pressure, by controlling your lipid profile and cholesterol, by controlling your diabetes if you are diabetic, to have regular exercise and to eat healthy food. Please remember that if you have early or premature menopause, if unfortunately you get your menopause before age of 45, that as well puts you in high risk of developing heart disease and coronary artery disease. If you are pregnant and you develop hypertension during pregnancy, if you are pregnant and you develop gestational diabetes during pregnancy, all of the above increase the chance of you developing cardiovascular disease. Earlier I talked to you hypercholesterolemia or increase the lipid profile. Please remember, by the time that you get menopause and hormonal changes in body itself will result in increased cholesterol, increased triglyceride, increase the bad cholesterol, which is LDL, and reduction of your good cholesterol, which is HDL. So we women, especially after the menopause, we have to take care of ourselves in more intense way than we were doing before. So again and again, a regular checkup for your risk factors to develop coronary artery disease is very important. We have to try our best, not only to recognize these risk factors, also to control them in a way that we have optimal blood pressure control, we have optimal LDL control, and we have optimal diabetes control. By reducing all of these risk factors, we definitely one step ahead in the battle against cardiovascular disease.